Okay, thank you very much. Like we have already introduced ourselves. Fiona Luma from Wem'Afrika, the humanitarian department. So I'll be moderating this webinar on the International Day of Older Persons. And I want to welcome our speaker, Miss Yvette Ngemise, for granting us this opportunity to share her knowledge on, at least she has a background with nursing. I believe she's going to be a great help with shedding more light on this topic. Okay, so just to give an overview of the International Day of the Older Person and what it's all about. The day is celebrated to raise an awareness of the opportunities and challenges that are faced by the aging populations worldwide, and also to call on stakeholders to address these difficulties that the older population face. And this year's theme for the International Day of the Older Persons is Aging with Dignity. And that is highlighting the importance of strengthening care and support systems for older persons worldwide. Okay, it's also important for us to recognize the fact that the older adults can also be an asset to our communities through taking leadership roles and also through contributing their skills and experience or their expertise over the years to encourage us, the young ones, or to teach us the things that we ought to know. At least the older persons also have these little contributions that they give to us. Okay, talking about this year's theme, Aging with Dignity. Aging with dignity simply means living a meaningful life free from discriminations, abuse, and neglect. It is simply maintaining yourself, your self-worth, even as your physical abilities change. So that is just an overview of the topic of this year, Aging with Dignity, and then highlighting the importance of strengthening care and support systems worldwide. So I would like to call on our speaker, Ms. Yvette Ngemise, to throw more light on how we can actually strengthen the care and support system of the older persons worldwide, at least with her knowledge, in her background knowledge of medicine and nursing. She actually has an idea of what exactly we need to know concerning the older persons and their health, and how the community, how we too can come in to help the elderly people, what we can actually do on our part to help these people age with dignity and to strengthen their care and support system. So thank you very much, Ms. Yvette, for this opportunity. So we would like to hear from you. Thank you.
Thank you so much for the opportunity to speak on such a topic. It's actually a good topic because we have many people aging in our community. Even us as younger people are also going to age one day. So it's important both for the young people and for the old people to get to know about such a topic. So I'm going to be talking about the health challenges old people face and in ways which we can help support them with these health challenges. Talking about aging, as one gets old, it's but normal that your body organs will also age. It's but normal that your body organs will also get old. So there are actually some very common health challenges that these old people face because they are aging. I'm going to start with the first common health challenge is mostly heart diseases. Almost like 65% of the world's population have heart diseases in their old ages. For example, where I work presently in the cardiology station, I work in the surgical and cardiology station at the moment. And then the cardiology session, you see that most people after 60, 65 years always come with heart problems. Some of them either have heart insufficiency or they can have high blood pressure. Why do you have this heart insufficiency, or what in total is heart insufficiency? For example, it means your heart is not pumping enough blood. As a young person, it pumps normally, strong, well. But as you get old, the heart itself also actually it stays the same, but the veins, the arteries going to the heart, for example, the aorta and the other Gefäße. I will say Gefäße, but that's the German word. I have to speak English now. The veins and the arteries going to the heart actually have to pump the blood or distribute the blood to the different organs. But these veins and arteries also get old and get weaker with time, that they cannot distribute properly enough blood to the organs. And this blood is going to accumulate probably somewhere in the leg, it's going to accumulate somewhere in the lungs. And you see that maybe the old person may have swollen hands or swollen legs, or he's not breathing well because there's an accumulation of blood, and this blood will now force water out of the organs or out of the veins into the organs of the body. So heart disease is actually something that disturbs our aging population, but there's a way we can support them. We know when someone gets old, we have to tell him or her, even our parents, go regularly to the doctor, check your blood pressure. If the doctor tells you you have a high blood pressure or you have a low blood pressure, then take the medications they give to you. And as young people, we also have to do enough sports in order to ensure that we have a good cardiovascular system. So I would say to support your old people with regards to heart diseases, tell them to visit the doctor regularly, tell them to check their blood pressure, tell them to eat less fats, because if you eat much fatty foods, this fat is going to accumulate also in your arteries and veins. And your arteries, like, should I say, almost like this type of tube. I will say this type of tube, like this pencil. And if things accumulate here at the side and things accumulate here at the side, then the blood cannot flow very well because it's so thin, it can no longer flow. So we have to tell them, eat less fat. And for those smoking, I think actually, I will not say more than half of the world's population, but many people do smoke, and smoking is also going to affect you having a heart disease in an old age or not. So we have to tell them, please, less smoking, don't smoke. It's going to affect your arteries and veins. Heart diseases is not the only health challenge old people face, but also old people face the disease they call diabetes. Everybody, I think even a young child will know what diabetes is. If you want to say in the layman's language, you will say the sugar disease. What's diabetes? Diabetes is simply the inability for your body to be able to process the sugar in your blood. It means you have so much high sugar in your blood. And this is something common among old people. There are actually two types of diabetes, the type 1 and the type 2. Type 1 is probably, it can occur in younger people too, but type 2 is mostly common in old people, the aging population. And if they do have this diabetes, I tell you, diabetes has a lot of complications. If you have diabetes, then it means probably if you have just a small wound, the wound is not going to heal properly because the diabetes is causing your blood not to flow probably to where the wound is. And your blood has everything that is going to fight against the wound for it to get healed properly. So when we have old people aging, we have to tell them that they have the risk of having diabetes at an old age. What can we do to support them? We have to act, we have to ensure that they have a good diet. They should actually eat less sugar food or less carbohydrates, something like that, just to reduce the sugar intake in their diet. They should try to do a lot of sports. And we should also do the sports with them, not just saying do the sports, do the sports. Your action has to speak louder than your words. So you have to actually do with them. What else can you do? You also have to check your blood sugar regularly as an old person. Once, sometimes just go to the doctor for a regular checkup. You don't know if you have the diabetes or not, but just go to the doctor for the regular checkup and check your blood and see if you have the diabetes. They'll not tell you immediately you have diabetes. You check, and maybe they'll tell you come after 3 months. We have to check again after 3 months and see if there's something they call the HbA1c. That's what we check in the blood to see if you have diabetes or not. So after 3 months, we have to see if this HbA1c, A1c, 1 is German, 1c has increased in the blood. And what else can your old person do against diabetes in order not to have diabetes, or when he has it in such a situation? We have spoken of diet, we've spoken of sports, and we've spoken of checking your blood sugar regularly. Okay, another complication first of diabetes is there's something they call diabetes foot. For example, the old person will have a wound in his leg or his toe. It can get to the point where they have to cut this toe. They call it amputation, just because the wound is not healing properly. Why is that? Because he or she has diabetes and the blood is not getting to that part of the body where the wound is. And actually, the blood is supposed to come with the white blood cells, the leukocytes, to fight and give your wound to be able to heal properly. So diabetes is something which affects our aging population, and that's something we have to help them. Just knowing that dad, mom, grandpa, grandfather, we have to check your blood sugar to be sure that you don't have diabetes. And if you have, we have to do certain things. Also, if he or she has the diabetes already, he can take insulin. Insulin is what we actually, it's like an injection which we give in order for the person to have the low blood sugar in him. Insulin is actually being produced by our body in our pancreas, produce the insulin. But our pancreas keep producing insulin and the person keeps eating a high sugar food, keeps eating foods that have high sugar. At a certain time, even the body will be resistant to the insulin, or your pancreas will not be able to produce enough insulin for you to fight the high sugar in your blood. That's why we actually can give insulin as a treatment for the diabetes. And if the sugar level is not too high in the blood, we can also give certain tablets to this aging population to fight the diabetes. But the first thing is sports and a good diet. If you do that, then it's good. If you help that with grandma, grandpa, and even ourselves, with the aging population, it's good. Another health challenge that can affect the old people, I'm going to say, is talking about the bone and the joint diseases, or should I say lack of strength and weakness. It's probably very common. It's very normal that as one gets old, he or she gets weaker. He or she does not have so much strength to stand up, to walk, because the bones get fragile, the muscles get fragile, that they tend to have so many problems that they don't have strength to carry out their normal day-to-day activities. And this is when they need our help. Aging with dignity. How? Even if the person wants to move and go to the market, he may not be able to get to the normal distance he normally has to do when he was younger, or what he normally does when he was younger. But if he has a granddaughter, he has a neighbor. As the younger people, we should help to assist these people in their day-to-day activities. If it means going to the market for them, we should go. How can we assist them? If it means buying a dishwasher for them, we should buy. If it means buying a washing machine for them, we should buy. If it means taking and bringing in a house help, just to help with the house activities, we should do. But if we do these things, we should not make our old people lazy. We say aging with dignity, it means they have to do something. They should not just sit and cross their arms. Because if they sit and cross their arms, it means they move their body less. And if you move your body less, it means the blood flowing in your body too is also it's not really going to move so properly. It's going to be stagnant in a way that it can cause a blood clot, what we call thrombosis. And this blood clot can cause so many diseases in the body. It can cause lung emboli, where probably going to the lungs, the oxygen that's supposed to live through the blood, because blood is in oxygen is in blood, and this blood has to reach your lungs. If this blood cannot reach your lungs, it means the oxygen does not reach your lungs. It means you'll not be able to breathe. So we have to tell these old people, even though you have the lack of strength, sometimes it's good to just go for a stroll, a 5 minute stroll, or walk out of the door. Don't just sit down because your daughter has brought the house, get to the house, or because you have the house help, or because you have the grandchildren who do everything for you. We have to tell them that you have to age with dignity. You have to at least walk, do some exercise. There are some balls we have, even in Cameroon. We also have these balls where you see people just squeezing the balls like this. It's just to able to move their arms, to move their joints, to move their muscles. They have to do a certain form of exercise and not just sit and fold their arms, because it's not good. And if they remain in one position always, there are many grandparents in Cameroon. They just think when somebody has reached 70 or 80 means just sitting one corner in the parlor or one corner on the staircase behind the house, or just lying in bed the whole day. I will not blame them. There's lack of strength when you're old. But if you lie on that same position every day on the bed, you lie on that same position, you're going to have something we call bed sores. And for example, if this person lies, for example, the person is lying on this same position, on this position where he or she lies, let's say he's lying on his back. On the back, he's going to receive a bed sore because he's putting pressure on his back. And putting pressure on his back is putting pressure on the skin of his back. Because he's putting pressure on the skin of the back, the skin is going to break and it's going to have a wound. And this wound the skin is going to open. And when the skin opens, it's a wound. And when the wound opens, the person is still lying on the back. This wound is going to get deeper and deeper till it reaches even your bone. So we call it a bed sore. So we have to tell them, if the old woman, the aged person, does not have the strength to move from the bed or to move to the chair, at least change position, sleep on the side today, sleep on the other side. Don't sleep just on your back. Or auntie, let's go to the chair today. Auntie, let's go to the parlor today. Let's walk and go to the room. Let's walk and go to the kitchen. Let's take a stroll to the garden. Let's go to the market. I'll hold your hand. But with the lack of strength with the aging population, to able to support them, we have to tell them, let's do some certain form of exercise, buy them this thing that they can move, anything. Or there are some elastic ropes which we also have. You can also, I'm going to use my charger now as an example. There's some elastic ropes that you can just tell them to pull. Just pulling this just helps them to exercise their biceps and triceps, just helps them to exercise their hand. But a certain form of exercise is going to help them, because after the age of 65, I've seen so many people here after the age of 65. I work in the surgical station. They come because they need to have operations, especially they call it hip operations, or with their bones, because they are suffering from arthritis. Arthritis is something that's going to affect most muscles in the aging population. So tell them that you have to move. You have to move. Age with dignity. Show them that you can walk. Age is just a number sometimes. Okay. Another common health challenge the old people face is something everybody knows. It's something even us have seen on TV. It's what we call stroke. You want to see, they say, oh, what happened? He died from stroke. Oh, what happened? He's suffering from stroke. He cannot move his hand. Why? He had a stroke. His left side is he has paralysis. Why? He's paralyzed because of a stroke. That's something that affects the aging population. Yes, even a young person can suffer from the stroke, but mostly the aging population do suffer from stroke. What can cause a stroke? A stroke is actually when we have blood, we have blood going to our brains, we have blood going to our head. And now, if this artery, which is taking the blood to the head, is being blocked by a blood clot, it means the blood will not reach the brain because the artery is being blocked. I hope you understand what I mean by artery, of course. An artery is just like, should I say something like, not really a tube, but yes, it's taking blood to the veins. If it's been blocked here, my brain is here, right? If it's been blocked here, I'm showing so many illustrations using some type of things. I hope you understand me. Okay. If my brain is here and blood is supposed to get to my brain, but if it's actually taking blood to my brain from my heart is blocked here, it means the blood will not get to the brain again. And if blood stop getting to the brain in less than 30 seconds, like millions of neurons in the brain die immediately. And if these neurons die here in the brain, it means normally when the right side is affected, is the left side that gets paralysis. It means in less than 30 seconds, in a second, millions of neurons will die. No blood is getting here, and they normally feed from this blood. And if the blood does not get to this part of the brain, it means the neurons will die. And when the neurons die, it means this hand on this other side can no longer function, and the person now has a stroke on his left side. Or you see his mouth start bending around. That's a common health challenge. Why is it affecting our old people? It's affecting our old people because as they get old, their arteries and their veins also get old too and get weaker with time. And probably they either have the blood clot, or it must not really necessarily be a blood clot. It can also be caused by too much bleeding in the brain. But if the old person, for example, does not move too much, it can also be caused by the blood clot. Because it does not move too much, we call it a thrombose, and the thrombose will now cause the Verstopfung is German. Sorry that mixing, sometimes I mix German and English. It causes I need to think of the word. Okay, it causes the blocking of the artery and the blood does not get to the brain. But how can we prevent stroke from our old people? We first of all have to inform them about this disease called stroke. Tell them what they can cause it, and tell them that they probably need to go regularly to the doctor. It can also be caused by high blood pressure because of their high blood pressure. It can also be because if they, for example, those who smoke, if they were smoking at a younger age and they've smoked for like 20 years, the more they smoke, this artery which is taking the blood to the brain is being accumulated by the how they call the stuff from the smoking. Whatever they smoke, whatever, I don't know, weed they smoke and everything they smoke can accumulate in the arteries and will keep accumulating from year to year, from time to time, and actually make this artery to be closed, and the blood will not get to the brain. So we tell them that they should stop smoking. Please, grandma, grandpa, stop smoking. Stop taking alcohol. All these are going to accumulate to. Then also you have to act on your diet. You have to think of what to eat, because even the fats can also accumulate in the arteries. So anything that can block the arteries and the veins, we tell them to stop their intake of that and have a good nutrition. Then they should also do more sport and not just sit down. So it stops making the blood to clot somewhere around the brain. And also high blood pressure. We also have to check their, goes back to heart disease again. We also have to continually check their high blood pressure. One other health challenge which can affect our old people is what we call loneliness and depression. Everybody's getting old. Even the young people are getting big, and everybody's gradually leaving their house. You see that a house which normally has 10 people, 5 people inside, gradually one person passes his A level and goes to the university. The other person in the university graduates and gets married. The other person falls bush, or the other person goes abroad. And now the house is practically empty, and the grandmother is probably just alone. Just because she's alone, this loneliness can lead to depression. And this depression can make her, sometimes she'll not even have appetite to eat. So how can we support them in such way, in this type of condition? With our aging population, we should tend to visit them sometimes. We should understand that sometimes they are lonely at home, or even though they have retired from work and they don't have anything to do, take their grandchildren to visit them, pay them visits. Or even if you cannot pay them visits because you're very far away or you're in different towns, then call them from time to time, check them on from time to time, because loneliness is something which is as serious as a heart disease or as a heart attack. So we should help to support our old people with their aging, because they have to age with dignity. And if we do help them age with dignity, we shall also be able to age with dignity, because by supporting them, we inform ourselves on things that can affect the aging population. And also, when we are aged, we'll know how to combat these challenges. Thank you very much. Oh, let me not forget one more point. There's something that's common, but it's mostly common here. Actually, my time working in Cameroon, I really did not see this among our aging population, but I've seen it a lot here in Germany. It's what they call dementia. As the people age, they get to forget a lot of things. It has not really been so common in Cameroon, or I've not seen so many old people having this in Cameroon. But to tell you the truth, I can have like, out of 100% of my patients, right? Like 70% have dementia here abroad. It means they forget a lot of things, and they can say, the person will be saying, Susan, who is Susan? Susan, where is Susan? Is not here, you're in the hospital. Susan is probably the daughter or the sister-in-law, or the person does not know her name or does not know where he or she is. And this is just what they call, it's something that comes to old age. There's the Alzheimer, which is different, but there's also the aging dementia. Because they are getting old, they tend to forget a lot of things. They can forget their names, their date of birth, or they are just confused. Who am I? Who am I? They'll tell you that they're in another town, which you ask them, what's the day of today? They tell you, what's the day of today? The person is telling you blue. Just like, I think like 2 weeks ago, you're like, what's the day of today? The person is telling you blue. So with this kind of disease, or with this kind of health challenge, you need to be there with them. Tell them, bring them to the present day. Don't make them feel they are confused. And actually, you can put pictures of their loved ones in their room, and it can bring their memory back. For example, maybe the son will come and visit, and they're like, no, 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 go. I don't know you. Who is this? Who is this? Go. Just put pictures of the family in their room. It's going to bring the person's memory back. Talk to them about their family. And you're like, Susan is not here, but we can call Susan. But in Cameroon, I've not seen this so much among the old people, but it's something which happens. There are some people in Cameroon who actually have dementia, some aging population. But since we have our aging population staying with us in Cameroon, that's one difference. The old people stay with us at home, and yeah, they have the old people system. They have the old people's house, where they just send them to the old people's house, and they can obviously forget family. But dementia is something which affects the aging population. And to help combat with this, it's just like loneliness. Remind them of their family. Make If the family have contacts with them, then bring them to what is present. Give them the newspaper to read, make them to watch the TV and to watch the news. Then maybe probably their memories can come back gradually. And the last but not the least, to support the aging population, we just have to be patient with them. As one gets older, the body, the organs also age. So we have to be patient with them. And in their old age, they'll be able to age with dignity because they'll not be ashamed of it. They don't know it's just part of the process as a human being. Okay. Thank you. And that was my presentation.
Okay, thank you very much, Miss Yvette, for this very enlightening information. It was so amazing. I've learned a lot about all these health challenges that the elderly people face. I mean, I actually did not have an idea of so many of these things. And I want to appreciate the fact that you also gave us remedies to all of these situations, and it's very enlightening. Thank you so much. I hope, I want to ask if every other person connected was able to get the full presentation, so we will not have to go over it again. Thank you so much. Okay, so concerning these health challenges that the old people face, I just wish to find out, among all these heart diseases, diabetes, the bone and joint diseases, the depression and loneliness, I want to ask, for the old men and the old women, is there a is there a percentage, is there a particular disease that is common with the men, or is there a particular disease that is more common with the older women among all these ones that you listed? Are there particular illnesses that are common with men and the particular ones that are common with women?
Yeah, there are actually some particular diseases which are more common in men and which are also more common with women. For example, with the bone and joint diseases, we have something they call osteoporosis. Osteoporosis is more common with women. That's like they're having their bones break easily. It's more common with women and it's less common among men. That's just an example. Yes.
Okay, thank you very much. And also concerning diabetes, as you mentioned, I just wish to find out. I've growing up, I've known that diabetes can be inherited. I don't know if that is true. Like if your parents had diabetes when he was old, so there's a high probability that you two are going to have it when you get old or something. So I wish to ask, what is the truth behind the inheriting diabetes?
Yeah, actually, it cannot be inherited. If your parents had the diabetes when they're old, okay, they'll say there's like a 5% or a 2% chance that you have it. But gene to gene, that's not the cause of diabetes. If you take care of yourself and you watch your diet and you do the sports, then you will not have the type 2 diabetes. Because the causes of diabetes, the type 1 and the type 2, has nothing to do with the genes. For example, the type 1 diabetes or the type 2 diabetes. The type 2 diabetes, your body is producing enough insulin, but your cells are resistant to the insulin. So actually, it's not from your parents or it's not from the gene of your parents. But yeah, the 2% chance will say, but there's a hereditary from your parents, but it's very, very minimal. It's so minimal that I will say no. Mm-mm.
Okay, thank you very much again, Miss Yvette. So I wish to ask those connected, if anyone has a question, the floor is open to please send in your questions concerning the topic and for the presentation that Miss Yvette has given. We are open to questions and answers. I don't know if anyone has a question or a contribution.
I have a question, please.
Okay.
Eva, thank you so much for your presentation. I really enjoyed it. Thank God I did not study science, but I'm so happy that I also know you as well. So you can elaborate about certain topics. So my My question is about the sensitization about the older population, about the training. And you earlier mentioned about dementia. It's more frequent in Europe than in Africa. So first, my first question is it a lack of knowledge? I'm sure it exists, but do the people, are the population, the younger population in Africa aware about dementia? Do they think it's madness? My second question is about the culture. How do they embrace it in Europe and in Africa in terms of the aging population? Are they more welcoming? Is it more about social cohesion, or rather it's just about just living your life and just being happy? And my third question is um, about the care services. Do you think Africa or do you think Cameroon should really invest in the care services of older persons, or that it's just meant for the nurses only? Or do you think many youths should be trained about how to take care of the older people? I think that's my question.
Thank you for all your questions. 3 questions. Okay, I hope I remember all. If I don't, I'll have to ask you again. Okay, for the first question, you said talking about the dementia, the demence, the young population in Cameroon, are they sensitized about it? I think they are less sensitized about the dementia in Cameroon with regards to the younger population because I've also stayed in Cameroon too for a long time. In fact, I'm still a Cameroonian and I go to Cameroon for holidays. It's my country. Okay, and from what I see, the young people, or even just studying nursing in the University of Boya for 4 years, who had the topic the dementia, but probably was just like 8 hours class, means 4 hours today, 4 hours the next day, and that's all. Before your 4 years degree program. But yeah, in Germany, dementia is a topic which has to be taught so detailedly because they know that like 70% of the aging population has it. But in Cameroon, they mostly see it probably as you said, as madness. It's not really accepted generally. They don't really take it as demence, or even if the person has it, he or she is just left at home, or they don't do any therapy to it, or the person will just be walking up and down, or the old person just walking up and down in the streets. They will say it's madness. Sometimes they'll say it's madness. Or I think I worked even in the psychiatric ward in Douala when I had an internship program in the psychiatric ward in Douala. And there you also see less people having dementia because they are not really so informed about it. And those that want to show signs and symptoms of dementia, they'll tell them that they're probably mad, and they'll probably give them just diazepam to sleep or something. Yeah. So it's something that we have to work on in Cameroon. And I think that's where your second question or third question was going to. Do we have to sensitize the population about it and give them training, not only to the health challenge dementia, but I think generally the younger population in Cameroon, it will be best if we have more training on how to help the aging population for everything with regards to dementia. How do we recognize that a patient has dementia totally in general? How do you differentiate dementia and a psychiatric problem? How do you differentiate dementia and madness? That's something we need to draw a borderline to, because how will you even know? But because it's not something common in Cameroon, the Ministry of Health does not take it as a big topic because it's not something. How Primarily, just 3% of their population is suffering from dementia. So it's not something that Ministry of Public Health will really take as something that let's make a seminar about, let's do this, let's sensitize this population. But actually, this 3% of the population are still people in Cameroon. They are affected by it and which need help. So I think it's something we have to sensitize the population about it, or at least just give them some certain tips on how to go about it when you find somebody with dementia, how to draw the borderline, what you can do to help the person. Yes. And what was the other question? The other question was, can you help me?
I think the other question was about I've even forgotten about the culture in
Mm.
Europe and in Africa, and how do they approach that? How do they really try to embrace that the aging population?
Yeah, they put a lot of value on their aging population here abroad. As with regards to Cameroon, I think in Cameroon, the aging population, they are all retired. They're not bringing money into the system, should I say, or they're not working. But yeah, they give so much attention to the aging population that they tend to live so much, should I say, longer. because like they'll build the old people's home. They'll ensure that they all have their health insurance to come for their health checkups. But then Cameroon is either everyone for himself, God for we all. If your family is not taking care of you as the grandmother in the house or as the great grandmother in the house, then you see the grandmother being alone in the hospital. And if she does not have, Pauline, if she does not have 100 francs to buy her gloves or 5,000 to pay for her malaria treatment, then she'll stay in that ward in Cameroon if she does not have a family member that will come and say, hey, I'll pay for my mother's drip, give her this malaria now, I'll give her the malaria treatment, I'll pay. But if the grandmother does not have the money to pay, she does not have the family members to take care of her, then she will not be treated properly with her health challenge, whichever health challenge she's facing. But yeah, abroad, they give so much attention to the old people that even if they are without families, they still have the healthcare system supporting them. And that's what we don't have in Cameroon. If your families are not taking care of you as the old person in Cameroon, then forget. What about those in the village who don't even have access to even talk of going to the hospital? At least there are people that even go to the hospital, but they don't have money to pay in the hospital. But there are others that cannot even leave the house to go to the hospital because of our healthcare system. So we're supposed to have a healthcare system that even checks even on those old people at home, those that don't have family members, that give attention and say, okay, we should have like an old people's club. There's something here they call old people's club where they have a house or a home where they go for their regular meetings. Let's say every Wednesday, the old people in this town should meet every Wednesday just to talk among themselves. This it helps to reduce the depression, it helps to reduce the loneliness, and it helps to also know if this other person is sick. And why is this person not here today? Because him or her has a heart attack or he has a fever at home or something. But in Cameroon, it's everyone for himself, God for we all. But I think our system is getting better. At least we have the Ministry of Public Health. But I would say we should try to put attention even to the diseases which does not affect the big side of our population. Even if it affects just 5% of our population, I think we still need to put some attention to it. And that's why I would say I find your webinar very good, which is addressing such a topic about old people, because you say we're celebrating the Old People's Day. Have you seen them marching on the street say that they're celebrating the Old People's Day and making it like a very big topic? Because it's not something which is affecting a big side of their population. But if it's World Malaria Day, you will see the flyers everywhere, World Malaria Day, World AIDS Day. I understand it's affecting a huge side of their population, but we should also address other diseases which affect our population because it's still part of Cameroon and it's still part of us.
Thank you.
Okay, thank you very much, Miss Yvette. This is a very enlightening session. Thank you very much for your contributions. And for those joining now, we are simply highlighting the importance of strengthening care and support systems for older persons worldwide. So we have as our speaker, Miss Yvette Ingemise, a medical personnel both in Cameroon and in Germany. She has given us health challenges faced by older people and how we can actually support them through these challenges and how we can also mitigate their effects on the older population. So she gave a rundown on a lot of common health challenges that that old people face. We have heart diseases, diabetes, bone and joint diseases. She mentioned stroke, which is a very common illness for the old people. She mentioned depression too and loneliness. As the old people get, as time, as you are getting older, you tend to get depressed about everything that is happening around you, your body. So yeah, depression and loneliness. And she also mentioned dementia. So now we are simply asking questions and contributions. Anybody who has a particular question or a concern about this topic, aging with dignity, and highlighting the importance of strengthening care and support systems for the elderly worldwide, not Cameroon, it's just worldwide. So any other question, the floor is open. Any question? Okay.
Diana, please.
Hello. Hello. Good evening to everyone. It's Bianda talking. I do have a question. Yeah, I listened to the presentation and to the question Ms. Pauline asked with regards to dementia and the response. But I think another approach could be, in terms of question I do have to ask now, it has to do with the feeding. I heard the presentation, but what could be the recommendation in terms of feeding that we have the nutrition and the diet that we need to follow for our elderly people when once they reach the age of 60 to avoid some health related issues that could cause difficulty in collaborating or relating with them.
You're muted.
Sorry, I was muted. Okay, thank you for your question. With regards to your question in terms of nutrition with our aging population, there are different things which we can do with regards to our nutrition. For example, cutting down on the sugar, first and foremost. Diabetes is very common with the aging population. So we have to cut down on the sugar. There are different ways which you can replace your sugar. Either you drink the tea without sugar, or you can give the aged person tea with honey. Or even if you want to eat yogurt, you can eat yogurt without sugar. But in terms of sugar, you can put berries, or you can put apple, you can put fruits inside, and the fruits will make this yogurt sweet. Reducing salt. That's because if you reduce the salt, you reduce the amount of sodium in your body, which is going to reduce the risks of having heart diseases. So reducing the salt, reducing the sugar, also reducing the carbohydrates they get, because sugar too is also it's not just normal sugar that you eat, but you can get sugar from food, and foods such as carbohydrates. You can also get it, but there are different types of carbohydrates. There's a simple form of carbohydrate, or the simple form of sugar, and a complex form of sugar. So I'll say, instead of eating white bread, if it's possible, you get the brown bread to eat, because the brown bread has a complex form of sugar, which is going to take a longer time to break down. But the white bread has a simple form of sugar that when the person eats the white bread, it's going to be broken down easily by the digestive system. Let's say white bread, the sugar is like this type of form. The person eats the white bread, the digestive system simply breaks down the sugar, and it's being digested. And automatically, after 2-3 hours, he feels like eating again. He'll go and eat again white bread, or go and eat another simple form of sugar. Digestive system will break it easily. Now he's always accumulating the sugar in his blood. But if he eats brown bread, for example, this brown bread, or if he eats bread that has a little bit of corn, maize, something on top, this brown bread has a complex form of sugar. Now I'm going to make my fingers like this. It has a complex form of sugar. That if he eats it before the digestive system wants to break down this sugar, it's going to take a long time, and making him not to eat again sugar, which is going to accumulate in his body. So we have to note the kind of sugar or the kind of carbohydrates we eat, for example. As spoken of carbohydrates, less oil when you're cooking your eru. If you're cooking your stew, if your mother, or if you yourself, what's your name? Bianda, I can see that it's called Bianda's Galaxy. So I'll say your name is Bianda. If Bianda has not used two cooking spoons to make the stew, or when you cook dole in Cameroon, when you cook dole, at the end of cooking the dole, you always have to put granite oil again on top so that the dole will shine. Like seriously, it's not it's being shiny. Do you want the dole to also shine in your stomach? Use, even if it's just 2 cooking spoons of oil to cook the dole and mix the vegetable. You'll see that it will still mix and with the water. Or even if it's fried rice, use just 2 tablespoons, 3 tablespoons, depending on the quantity of rice you're cooking. You must not use 2 dishing spoons of oil or half of the container of oil. So reduce the amount of oil you use in cooking. If you're cooking beans, you must not use 1 cooking spoon. I'm using the example cooking spoon because now I presently use a tablespoon of oil or 2 tablespoons of oil. That oil will still be sufficient for that pot of food. You must not see oil shiny at the top of your pots. So we tell the aging population, cook with less oil, eat less sugar, whatever. Drink much water, because with the aging population, there's also the health challenge called dehydration. I know it in German. Okay, they tend to dehydrate. It means they have dry skin because they drink less water. So we say drink more water, eat more fruits. But when you eat fruits, tell them to eat fruits better mornings and afternoons and not in the evening. Because also, I will say, talking about eating in the evening, it's best to eat between 6 p.m. to 8:30 p.m. and latest 9 p.m. Because after 9 p.m., your body produces melatonin, and this melatonin is to help your body to sleep, to relax. It's not there to start digesting food again. So if you eat after 9 p.m., your body, your muscles are not moving to digest food. So all of this is going to accumulate in your blood as sugar. All this food is going to be accumulate from all the sugar from the food is going to accumulate in your blood. Your body is not doing anything to digest it. It's showing relaxation time. It's going to try to digest it, but it will not digest it as fast as it will have done if you ate in the afternoon or you ate between 6 to 8. And you keep eating like this every day after 9 p.m. You keep eating like this every day after 9 p.m. You're going to have a certain accumulation of sugar in your blood, which is going to cause now diabetes. So we'll say it's between 6 to 8:30, latest 9 p.m. because after 9 p.m. your body cannot digest the food again. But if you eat well in the afternoon, you eat well after 6, you're still walking around, you're still doing things which will help digest the food, take the energy from the food. What else can I say? I can talk about this topic over and over, just about talking about nutrition. What's there to add on nutrition again? We're talking about breakfast. Try to eat carbohydrate soup for breakfast. I think I've given a summary of that. Try to drink 2 to 3 liters of water a day. But if the old person has heart insufficiency, has a problem or a kidney problem, then we'll tell him or her to drink less water, like 1.5 liter a day. But if the person does not have a kidney problem or a heart disease, then he can drink 2 to 3 liters of water a day. But with a kidney disease, if he has stage 1 and stage 2, he can drink normally. But if he has stage 3 and stage 4 of the kidney disease, then he should drink less water in a day. I hope I've been able to answer the question a little bit in terms of nutrition. Generally, especially in Cameroon, we cook with so much oil, red oil, groundnut oil. We have to reduce that one. And also, in terms of carbohydrates, don't eat the big lump of fufu. Reduce the fufu, and generally, the plate of food should always have, if it's possible, your plate of food should have carbohydrates, proteins, or it should always have fruits, vegetables, and carbohydrates. At least there should be vegetable there or a fruit there accompanying your plate of food. Yeah. That's just a summary. I hope I've been able to answer the question a little bit.
Yeah, I think you definitely you have, and I really do appreciate that. But I think one of the difficulties or challenge that we may encounter, I don't want to use the word stubborn because generally when you speak to parents, they will always tell you that see me picky where I don't want to use the one can't teach me anything. So they are more reluctant to adhere to what you are telling them. Like I have a mom, I will take my case. She's fond of eating very late at night, like 9 p.m. and she's really old. And she will prefer the normal ordinary bread to brown bread. And in terms of feeding, the oil you're talking about, the salt, I've even tried as much as possible of taking away Maggie from the house and try to make sure she eats less salt. But she doesn't really understand. She really don't understand. And when I observe around also with friends, you remark what you notice is that their own parents also face the challenge and they only come to an understanding when the problem actually arises. So I don't know if in handling, if you could provide some advice or strategies on how to easily communicate these nutrition tips with parents for them to actually understand, not
Okay. As you said now,
want
they can
to
actually be
impose on them.
stubborn, and you cannot force the food into their mouth. You cannot force the food out of their plate. So one way you can easily communicate to them will be best if when they visit the hospital or you bring a professional to speak to them, let a doctor, because they'll be afraid of that doctor, that the doctor is saying the truth because he has seen patients in the hospital. So if they hear it also from a professional, because they will say, the picky was sent for school, one can teach me book now. So but if they hear from a professional, a doctor out talking out of experience, that mommy, when your mother goes to the hospital, maybe she has gone there, she has malaria or something. Just corner the doctor and tell the doctor that, please, can you tell her to stop eating this thing? Because she's always eating this food. Just tell the doctor what she does wrong at home. Then the doctor will be able to bring it into the discussion when he's talking to her and say, Mommy, you have to avoid eating this. So you know that it's like that. Last week, a patient died of this thing. Oh, a patient that was 65 years. Mommy, they wish years today 65. Hey, a patient that was 65 died of this. The doctor should at least a professional to talk to her. From that way, she can listen. On the other hand, so you can also use her friends, the friends who have accepted to practice what you're saying, that they accept to eat the other form of bread, can also try to persuade her not to eat that bread. And also, you know that change is not just in a day. So maybe you tell her that today, okay, you eat this your bread now, but eat half of this bread and eat half of this other bread. Then let's see, she can reduce it small. She will not just change her diet all like that at a time. It's going to be a long process. So I think you should just give her some benefit of doubt and tell her that, okay, today we're eating small of this and small of this other one, so that gradually she'll fall into your own nutrition plan. But it takes some time and it takes some patience. I think
Patience. That's something that we don't have. It's actually luxury now.
yeah. But also tell
Okay,
them
this
when
might
they notice that somebody else has died of that thing or somebody else is suffering from that because the person, you see, are you seeing that I've cut that woman's leg? That neighbor that cut the leg because she's suffering from diabetes, too much sugar. You see that the next day she reduce her sugar small. Just give her the complications that have happened in real life situations. Then they may also understand soon that.
okay. Thank you. I do have the last question. I'm sorry if I'm monopolizing the mic. The last question that I do have is, okay, I want to know the differences between dementia, schizophrenia, and psychological problem. I thought
Amnesia, schizophrenia, and
psychological, psychiatric or psychological problem.
okay, psychiatric problem. Okay. Amnesia is actually when the person gets to forget things. Maybe he forgets time. There's something when you have to check if the patient has amnesia or not. You have to ask about time, place, I have to say it in German first. Zeit, Situation, und Person. Okay, Person. Okay, the person forgets his person. It means he forgets his name, his date of birth. The person forgets time. The person forgets what time is it now. The person forgets what day is it now. The person forgets what month is it now. Zeit, Person, Situation. Then the person forgets the situation. The situation means the person forgets where he or she is being found, like what's happening in his life now. You're like, where are you? Where do you find yourself? He or she's in the hospital with you, but he will say, okay, or he's in Limbe with you, and he will say, I'm in Douala. Where are you in Douala? Or he can say, I'm in Douala. You say, why are you in Douala? The person will say, he's in a hotel room. Meanwhile, it's you in the hospital room. Okay, those are already signs of the amnesia, but the amnesia will actually be for a long-term process. Sometimes these people can show this kind of symptom, like you can say, what's your name? The person does not know his name. He says a wrong name. What's the date of today? He says a wrong date. They can forget it, and it's not definitely just the amnesia. Sometimes it can be because the person's from an operation, and because of the anesthesia from the operation, he's still recovering from it. Then you give him some time. But if it's in a long run that he always says this wrong date, wrong time, wrong in few months, he's always giving the wrong information, then you know that he or she is suffering from the amnesia. So amnesia is actually just the person's ability to remember things decreases. Yeah, or a situation. He forgets his family members, he does not know where he is. And the second was schizophrenia. With schizophrenia is actually a kind of psychological disease. But with schizophrenia, they can have mood swings. It's not really like bipolar. I would say bipolar, the person is happy sometimes and the person is sad. But with schizophrenia, the person is active today, he's normal today. He does not really forget things, but he's easily agitated with schizophrenia. He or she is easily agitated. Like when I was working in the psychiatric ward, I had patients with schizophrenia. Today are like, hey, I'm this. They're agitated. I want to do something. I want to go. I need to go now. I need to see my mother. Yes, I need to go now. They're agitated with little things. They're agitated with little things. Then sometimes they are loud. They can be aggressive. Then another moment, they're normal. They are calm. They're like, it's okay. But is this not the same person that was saying that he had to go? He had to go somewhere. Another few hours later, the person is normal. It's okay. So with schizophrenia, they have phases, but it's a psychological problem because your third disease you mentioned was psychological problems or psychiatric problems. Now, psychiatric problems, there are different kinds of psychiatric problems. Psychiatric problems is when the person is suffering from a psychological disorder. With a psychological disorder now, there are different forms. Even the thought of trying to kill oneself, having suicidal thoughts is a psychological problem. Someone being addicted to smoking and to drinking is also a psychological problem. Having bipolar disorder, today the person in the morning, the person is very happy. He's the happiest person on earth. He's today is a beautiful day. In the evening, he's I don't know. Where's my mother? The person is sad and crying. That's also a psychological problem. So psychological problems, I would say, there are problems with one's emotions, that the person behaves in different manners. And schizophrenia is an example of a psychological problem. And then also we have the normal one, which you call madness, which they will call in Cameroon madness, that the person has gotten, should I say, colomenta. The colomenta is pidgin. I'm just using the word colomenta. There, it can be caused either by induced drugs. The person is taking cocaine, and this cocaine has gotten into his brains, into his nervous system, that is making him not to reason properly. So the psychological problems is just you not being able to manage your emotions and you not behaving and reasoning properly. I hope I've answered the question in a summarized way.
Yeah, pretty well. I'm very happy with that. Thank you very much, Yvette.
Okay, you're welcome.
Sorry, last question, Yvette, please. How often should we do checkup? Is it after 3 months, 6 months, or how often should we do that? For a young person, for an older person, and for kids, please. Just for
I will say for a young person, actually, 3 times in a year is okay. Like you can just divide the year, 3 times in a year is okay. That you can go and visit the doctor. But between young persons, we have to also talk about men and women. With women, it's better you go to your gynecologist 2 times a year. It's recommended you go to your gynecologist 2 times a year. And if you go to your gynecologist, you can just use the same day you're going to the gynecologist to just check with the normal doctor your blood. Just go to the lab and say you want to do, they call it checkup. Yes. When I used to be in secondary school, before I go to school, you have to go to the doctor for checkup. It means they just take your blood. And when they take your blood, they check if you can even have malaria. You're fine, you're good, but you're supposed to start school. They tell that you have malaria parasites in you. It means the parasites are in your blood, but they're not yet, it's not yet high. They're trophozoites. That's the parasite produce trophozoites. It's not yet too much in your blood that it has started causing the disease to work or to start functioning. So they'll detect and see maybe the number of trophozoites and say, hey, we need to give you malaria treatment now. We need to give you medications before you go to school or before you start your career or your job the next week. So just go to the doctor, say you want to do a checkup, and I'll recommend for young people 3 times in a year. And for the aging population, people above 60, they have to go more regularly, as often as possible. Maybe every 3 months possible. Let's just say 4 to 5 times. And for children, I would say it's hard to say. It depends how young the child is, because a baby normally, I don't know if it's just here in Germany, but I think even in Cameroon, it should be, a baby normally has what they call a checkup appointment, which you must go to the doctor, just show your baby for a checkup. That's for baby. But if it's for children in kindergarten, children in primary school, then maybe you can just do 2 times a year. Yes, their immune system is not so strong to fight the infection, but because they're always among children and they can always get infections, their body will get used to these diseases or used to this infection and recognize it and say, this is something we've fought before, and fight again. So with children, you can take them 2 times a year. I would say young people 3 times a year, and elderly people more, 4 to 5 times a year, as often as possible for the aging population.
Thank you.
Okay, thank you very much for your contributions. Thank you very much, Miss Yvette, for this very insightful, enlightening session. I mean, I've learned so much. We all have learned a lot from your experience. And so far, all what we have been discussing about it has highlighted the importance of actually improving our care and support systems for the elderly. And I would like to say the call to action that I got from all of our from this session is sensitization. Sensitization, a lot of awareness has to be created around this. A lot of awareness has to be created about nutrition, about how the elderly people feed. A lot of awareness has to be created about even the various illnesses that were mentioned here and how to go about it, how to manage it, how to mitigate their effect on the elderly. Because I can say for a fact that I have old aunties who are of age, and there are a lot of things that have been mentioned here that they do not even know, and they are doing very ignorantly. So a lot of sensitization has to be done concerning the health and welfare of the older population, because it's very important. Because I've also noticed that a lot of old people die in our community not because of a particular issue, but just because of negligence. A lot of old people lose their lives that they were not supposed to because of negligence. So we have to carry out serious sensitization about all what has been discussed here, the health challenges, the effects, and how we can actually go up, how we can prevent these things. Even us as young people, we should take we should if we don't necessarily need to have to start doing dieting, eating healthy when we reach 60 years old. We can start now to start eating healthy now. At least we have the knowledge now, so we can begin this process now, so that by the time we are 60, we are actually aging with dignity, with all the confidence, because we know that okay, we have been doing these things since when we were still youthful, when we were still young. Like the doctor mentioned, a lot of exercises, we need to reduce on sugar and all of this. So I want to appreciate, thank you. Any other person has a contribution now, is not question, just something to add, something to remove on.
Um, I just remembered something with regard to Bianda's question about schizophrenia. I just remembered. Also, the patients with schizophrenia also have hallucinations. There's something I remember in school. They said the word schizophrenia was it means actually the person is seeing somebody else. He's seeing another picture. He's seeing something else. So with schizophrenia, something common among schizophrenia patients is that they always hallucinate. You're like, he's standing there, you know, seeing the woman and the two children, but you cannot see the people too. Yeah, they always hallucinate. I just remembered that's something with regards to the word schizophrenia. They say it's from the word schizophrenia, but that was when I was in school. At least I know that there's something in relation to that. I just remembered. Okay.
Okay, thank you very much for that contribution. Any other person has a contribution, so something to add?
Fiona, on the 1st of October, you visited Yaoundé, an elderly home. Please could you share your experience with us? How was it, and what recommendation could you give to others who are listening?
Okay, yes, that is true. We had a project we visited an elderly home here in Yaoundé, and I've been to that place twice, and from my experience, like what the doctor said, old people, there are a lot of health challenges that the people who are there actually face. A lot of health challenges, and I can say most of them actually have dementia. So I want to say, yeah, most of them have dementia. So I can say that dementia is something that is actually, it's not like it's not common here, but people just see it as something normal for someone who has gotten to a particular age, let's say 80. They just see it as normal that okay, he should be forgetting things by now. So I believe it's something that actually happens here regularly with the old people, because even at that home, the last I visited last year and this year, dementia too is a common disease among them. And also I also got to notice that the elderly people are mostly neglected. Yeah, they are neglected in our communities, our societies. Most people, when people are of age, even their family no longer want them. Like the caregiver at the home told us that some of them, when they get to contact their families no longer want them. So they are being kept now in the home, at the elderly home, and being taken care of. most people, when they get too old, I don't know, there's a scare. People are just scared to be around them, and that's where depression and loneliness comes in, because you can feel it from, they feel lonely. They always love when people visit, when people come around. They just love to see people around because they don't actually have that. People don't really visit as often as they should. Even their families don't come there regularly. So there's always that loneliness. And the caregiver also made us to understand that they too are busy. They have other things that they do around there. So they don't really have the time like to sit with the people and actually talk with them. So when visitors come once in a while, they allow the visitors to, I mean, interact with the old people, because they don't really have that physical contact with people, and it actually lifts their mood. Yes, it makes them feel elated to see people come to visit them. Yeah, that those are my observations about the old people that I came across with.
What are your recommendations and what do you expect us to do as an organization, as an individual? What do you think we can really reach out to them? What are the measures based on you reaching out to those people, having physical contact with them and seeing the situation? So what do you think we can do as an organization, as an individual, and how can we support them?
Okay, thank you. I will say, as a recommendation, I mentioned earlier that a lot of sensitization has to be done, because people don't really know that older people face some sort of challenge, and most people are not actually aware that a place like that exists here in Cameroon. Or yeah, I mean, most people are really not aware. So as an organization, what we can do is we can actually sensitize the community, the population, that okay, there are actually elderly people that we can reach out to, because these people are very neglected in our communities, in our societies. Nowadays, most organizations focus on women and children. So what about the old people? Who reaches out to them? Who does all the reaching out? Everybody is focused on children, women, pregnant women, but nobody actually talks about the old people, and they are actually there. It's just that people are not aware. So a lot of sensitization has to be done, a lot of awareness has to be done, and also constant visits, like continual visits to the elderly, is something that is actually fulfilling. I mean, when you see the smile on their faces, they are happy to receive visitors, to see people come around. Yeah, it's actually something that has to be incorporated, like not only on the International Day of the Elderly Persons once a year. At least it should be incorporated like a couple of times within the year, that people can visit the elderly, just spend time with that little time with them, just talk with them, at least just for them to feel like they are not left out in the community. At least they should also feel like people are thinking about them. Yeah, so those are what I can recommend: sensitization and constant visits to these people.
Yeah, thank you. Thank you, Fiona.
Okay, thank you very much. So I really want to appreciate our speaker, Miss Yvette Ingemise. She has thrown a lot of light and given us a lot of knowledge about how we can go about, how we can support these elderly people, how we can actually manage situations and the challenges surrounding them. It is very enlightening, because this is something that is not spoken about, it's not common around our societies. Even on social media, you hardly see a topic like this, or you hardly hear discussions about what older people actually face and how we can come in. Yeah, and it's something we actually have to look into to create this awareness, mostly even on social media, have more webinars discussing about this, and how to, and also encourage organizations and individuals to be involved in a cause like this. Yeah. So thank you very much for your contributions. I want to appreciate for your presence and interactions. It was very warm. It was a very warm seminar, and I hope we all have gotten one or two things from this very insightful webinar, at least a take home from all what has been said here. Even with you might not have an older person at home, but at least even you two have been enlightened about how you can take care of your own self while you are getting older, because age is something that we cannot avoid. So this can be a webinar preparing us 40 years from now. So I really want to appreciate the doctor for all what has been shared here. Thank you too for attending such an insightful webinar. I want to thank Veronica. I want to thank Killian for your presence, and I want to thank our boss, Miss Pauline, for this opportunity. Thank you for believing in us and for the work done. Thank you very much.
Thank you, Fiona.
Thank you very much, Miss Yvette.
All right, thank you to everyone, and bye-bye.
Okay. Thank you. We hope to have you, Miss Yvette, for another session, another webinar, maybe coming up. We can invite you for more. If okay.
You're muted. Yvette, you're muted.
Oh, I did not know. Thank you.
Okay.
All right,
Thank you
bye.
very much.
Pauline, thank you for the invitation. Your webinar was good.
No, thank you too. As Ella mentioned, at Wem'Afrika, we talk about health issue, and Fiona is responsible for humanitarian affairs. So in terms of maternal health, in terms of issues of concerning health, it's responsible for the humanitarian department. So we are trying to do our best to reach out to health professionals, to educate people about it, and we can share our ideas about it. So if one day you see me again, say, are you free, please? Just 1 hour of your time to talk about certain issues about the health. I really appreciate that. Thank you. All right. Okay, bye.
Thank you to everyone.
Fiona, you did a good job moderating the meeting.